I was attracted to the job at Central Maine Healthcare because it gave me an opportunity to come back home. I grew up in the greater Boston area and have been outside the area for about 17 years, but most of my family still remains. So I was the wandering part of the family who now had the opportunity to come home, not only from a personal point of view, but also to really lead a well-respected health system such as Central Maine. Most recently, over the last 5 years, I had an opportunity to work in the Denver, Colorado area for a large health system called Centura. Well, I always tell the story, I had nowhere to hide as a kid. My grandfather was an old-time general practitioner, so some of my earliest memories were doing house calls with my grandfather when I was as young as 5 years old. So as I tell the story, I was destined to be in healthcare one way or the other. The reason why I didn't become a doctor was because of second semester organic chemistry. Did okay in the first semester, did well. Second semester, where we had to look at three-dimensional models of organic compounds, just a little bit too hard for me, and I said, okay, got to take a step back and figure out what else I can do in healthcare to make a contribution. In my short time at Central Maine, I've had an opportunity to really get a chance to meet a lot of our staff and walk through many of our hospitals, our neighborhood clinics, our outpatient facilities, to meet with community leaders, and I'm struck by the sense of importance that Central Maine Healthcare has in our region. From all the way in Rumford and Fryeburg to Bridgeton to the coast to Lewiston and Auburn, we have a dramatic impact impacting well over 500,000 people in the Central Maine region. I'm a CEO who likes to find great people and give them the resources to do their work and get out of the way. My job is to provide the strategic direction for our organization and all of our hospitals, to pick and develop a great team of professionals and really help them solve the issues in our local markets and our communities, and hopefully become one of the most respected healthcare systems in the country. One of the ways in which I am going to be judged in terms of our success is what we do to improve the health of the communities that we serve. One of the major changes in healthcare is for hospitals to literally walk outside their four walls and engage more actively with our communities. It's not just about providing healthcare in our four walls, but providing healthcare in our ambulatory healthcare facilities, in workplace clinics, by helping large employers provide healthcare in a way that keeps their workforce healthy and productive. As Central Maine Healthcare, we employ about 4,200 people, and one of our responsibilities is to provide growth and development for all of our staff. We hope that we can provide career mobility. We hope that we can train our staff to take on different roles during the course of their employment with our organization. We're always looking to provide new opportunities for our staff to make a commitment long-term to Central Maine Healthcare. I think our biggest challenge in Central Maine, as it is in other parts of the country, is really to define what role our traditional healthcare system is going to provide within a new national policy that is focusing more on health and wellness than just taking care of people when they're sick. Now the focus is, what do we do with chronic illnesses in our community and in our workforce? How are we managing diabetes? How are we managing COPD? How are we managing congestive heart failure? What are we doing to keep our patients healthy and out of our emergency room rather than wait for them to show up? So a lot of our focus is now more on managing those chronic diseases and keeping them out of our hospital. If we go back to when I was little, I've been in healthcare all my life. Professionally, actually on the job, I've been in healthcare for 36 years. And so what keeps me engaged and keeps me excited is the change in healthcare that is constant. You don't choose healthcare unless you like change. You don't choose healthcare unless you like complexity. You don't choose healthcare unless you like a constant challenge and an adrenaline rush almost every day. So if you're like that, healthcare is a wonderful thing. If you're looking for a simple, easygoing business model that doesn't change, healthcare is not for you. So our big challenge as Central Maine Healthcare is to really go to where our patients and our communities want us to go. Today, we're a little more focused on hospital care than outpatient and ambulatory care. So as we work over the next several years, we're going to want to create programs and facilities where people work, live, play, and pray. And so part of what we want to do is we want to be totally embedded in those communities in a very different way in which we are today. The days in which people will travel to come to major hospitals or centers is really not here anymore. People want services when they want it, where they want it, at the time that they want it. We're in the period of time where consumerism is really dictating things very differently in our business and in other businesses in our country. So if we don't adapt to a growing level of consumerism, we won't be able to meet the demands of our communities as we go forward. On a personal side, I spend my time enjoying all of New England sports. I still read my Boston Globe sports page every day. I still follow my University of Connecticut men and women's basketball teams. My wife and I, Elaine, travel to every sporting event that our teams are engaged in. Elaine has gone to 14 consecutive women's Final Fours. We enjoy spending time with our family. We enjoy doing a lot of things when we're not both working in the community. And my wife and I are usually a good tag team where I tend to the hospital work and my wife is a very active community volunteer. So hopefully you'll see both myself and my wife Elaine in the community over the years to come. Blueberry pie is my favorite. As I understand, there's a little bit of controversy over what the official dessert is for Maine. And if I had to choose between a whoopie pie and a blueberry pie, I would choose a blueberry pie any day.